Right, it's Kev again. Time for a video. As I said last time, I'm pretty busy these days. Don't have too much time at all, but I'll see what I can do this week. So, first things first, disclaimer, teaching, non-profit, etc., etc. You know the score, criteria, blah, 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 case notes. We're going to be talking about this. So, let's get on. So, let's have a look at the task first. Right, so we're writing a referral letter. Okay. Doc Jones, Memory Clinic. So, we're informing him what we think and making a request. So, that's our purpose. Purpose. Alright. So, we're informing the reader and making a request. So that's going to be immediately apparent. Then the audience, intended reader, intended reader. What do I need to know to do what you want me to do? What don't I need? And how do you write it? What's the genre, the style, etc. Then you've got organisation and language. So for B, we need 350, 255, 555. Okay, that's what we need essentially for that. So, oops, is it not working? So that's what we need. Okay, so let's have a look and see what we can do with this one. So let's have a peep. Where are we? Now I've got lots of files here. Okay, so changes are on. Okay, right. So this is about, was it 218 words or something? 214 words. I think I checked it earlier. 214. Okay, that's good. So now, I will put full patient name. My name's Patricia. Spelly capital. Right. Okay. And I'll put the DOB. I think in this case it's 1930 something. Blah 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 blah. So she is 91 now. Okay, so thank you for seeing the above-mentioned patient. Just put thank you for seeing Mrs Welshman, who I suspect has blah 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 and who requires your assessment. And that's basically it. So that's all you need. I don't usually like this thank you for seeing. You can just put I am writing to request further assessment, because as it says, immediately apparent. You can do it, thanks for seeing, but, I just say, it's like when you're writing any kind of a letter, where it's like a job, I'm writing to apply for the position of blah, 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 I'm writing to apply for a place on the master's course of blah, blah, blah. Whatever you're doing, what's that key verb? Application, apply, request, so I would do it like that. Don't have to, but that's my personal writing style. Mrs Welshman is going to stand up on me, so we don't really need that here. You can put that at the bottom. So Mrs Welshman is a widow. She has 5 children, but lives alone now. Okay, do I really need this? I mean, what you can do is put, I'm writing to request your further assessment of management of Mrs Welshman, a 91-year-old widow. You could put it there. My spelling, yeah. So what you sometimes do, you put name, age, and occupation, or name, age, and are they like widow, single, or not occupation, but you get the idea. So you could do it like that. I'm writing to request your assessment of Mrs Welshman, 91-year-old widow, who I suspect has blah 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 blah. You could do it like that. So what you're doing, you're trying to build the case. Well, construct a narrative, build a case, or tell a story of dementia, Alzheimer's. So anything that's not related to that, I don't really need. I mean, if we go back to the notes, so again, so let's just have a look at them. So, more assessments, referred to the clinic, okay, dementia, Alzheimer's, requested further assessment. Okay, so now, if we take a look, okay, so widowed, 5 children, okay, unless that's going to indicate something like, you know, she's on her own, but again, what's that? That's not really my problem, really. If I was a GP, I might be concerned, I might be willing to arrange some home help or something, but I'm the memory clinic guy, so I don't really need this. This is not my problem. So, what I need from these notes is something that builds that story about why you think she's got Alzheimer's, what's the background. Okay, so a lot of these meds irrelevant to my purpose. So she had a fall. Okay, home assessment. Well, if she's in the 90s, I mean, when this was done in the 80s, she's obviously frail. So, you know, so, but that is not necessarily indicative of Alzheimer's, really, is it? That's indicative of just being old and kind of frail. I mean, what will we all be like in our 80s and 91? We might well be falling over too. So that's not necessarily indicative of what we want. Now, what is this? Because this implies she might not be taking them or forgetting to take them. Yeah, you know what I mean? So this could be indicative to support your narrative, this bit here. So this might be useful. So this, interesting, but not necessarily indicative of Alzheimer's. It could just be indicative, I say, of being old and frail. This one could well be. Okay, that's interesting. Again, all this stuff here. The Webster pack. Okay, it's again maybe she forgot, so use the pack. This is it. This is the main thing here. So she came in with her daughter, and they both want to talk about this. Her daughter and her can notice she's been forgetting. So this could tie in to this, maybe. Okay, so you see how we're building this story here, all right? So behavioral changes, trouble with decision making, forgetting things. Okay, and then assessment. Poor short-term memory, Alzheimer's, family history, and you explained, etc., etc., which I don't really need to know, because all I need is, you know, why you want me to assess her. Because she's got, you could say, a history, possibly, forgetting things. This was December 2014. Then we've got a few months later. What's that? You know, December, it's 5 or 6 months later. It could be getting worse. So this could be, you know, indicative, as I say. So what's this? What's this? This. Right. So, so what? Okay, interesting. Follow up for what? With Alzheimer's? Not sure. Now, right, again, unless you're going to make something out of this, again, so, you know, who are you writing to? Dr. Jones' Memory Clinic. Memory assessment, diagnosis of her memory. Cognitive functions, in other words, okay? So, do I strictly need to know this? Now, if you were talking about, if you were making some link of a non-compliance, but why was she non-compliant? Or was she simply forgetful? Now that would be, again, indicative. But this, Okay, what's that got to do with me? That's got something to do with me. High HDL, that's nothing to do with me. This could have something to do with me. Okay, so why the Webster pack? So we're not making as much out of this as we could do, because again, you've got to convince me. You're making the case. You're building the narrative of why you want this, why you think she's got Alzheimer's. Why do you think so? Anything in the background? So possibly, she was forgetting her meds. Oh, and a few months later, So today's episode, we're going to discuss a memory issue. What memory issue? You haven't. So right. So we don't really need that there. All right. I wouldn't leave that there. Sorry, I wouldn't put that there. I'd put that kind of here. On today's visit. What happened? I explained the difference. Well, okay, but why would you do that first? So, right, usually, as you know, any visit, 3 stages. The patient comes in and says, oh, doctor, I've got such a pain, blah, blah, blah. The patient comes and says, you examine, ask questions, and then you do something. You take action. You give some medicine, a prescription, or you refer them on, right? So that's usually it, in that order. Patient comes and says, oh, doctor, you ask some questions, and you do something, you take action. So that's the logical arrangement, really. Again, wow, Organization, logic, right? Is it clearly highlighted how well it's organized and laid out? The paragraphing, subsections within the documents are logically organized. The sentences, structure of the sentences. So, come back. So it's like, okay, so she came with a daughter. Okay, and what? So I would have put, right, this, right. So this, really. Now, you can put that there if you want, but then I wouldn't go straight into this. You could maybe go straight into this and then maybe mention the Webster pack a bit later. Please note, but unless you're going to do some things with it, most of this paragraph is irrelevant. Unless you're actually going to make something of it and say, well, maybe she didn't comply because she had bad memory, So I would probably grab this and put it, came with a daughter, as her family is concerned about I'm not going to bother with typing Mrs Welshman's poor blah 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 blah. Alright, so if we do it like that, right, that makes a bit more sense. Okay, so we can do it like that. So Mrs Welshman came with daughters, very concerned about Mrs Welshman's poor of memory, changes and decision-making issues. Okay, so we don't really need that. Okay, right. Now, I would move this down because that, that didn't happen first. So that probably happened later on at the end, so I would move that down. So what happened? So Mrs Welshman came with a daughter expressing concern. The memory test. Now, right, we don't really need to about the further attempt, just like mention a mini memory assessment showed poor short terms of memory in terms of date and time, etc. Okay, then maybe say something a little bit more about the decision making issues, poor memory, say a little bit more there. Okay, and then you can probably join this up to make it shorter. Confirm the year and the month for the date. So short term had problems with date and time, etc. Quite worried and requires assessment. We discussed, so I wouldn't put this, I explained, felt like you use kind of passive, to put the patient or the treatment first. The difference was discussed. The difference between dementia and Alzheimer's was discussed. Please note that the patient. Why should I note this? Why am I noting that? Why do you want me to note that? So, usually we do, in view of the above, I would appreciate it if you could make a full memory assessment and provide the diagnosis. Any queries? That should be, how do you spell? Is that Q-U-E-R, queries? Can never remember how you spell that. Queries, that's it. Okay, so let's back to the notes and see what we've got. So, so what happened? So, she came. She came. Memory issue, forgetting things, behavioural changes, family conflicts. So, that's stage 1. Patient came and said, blah, 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 blah. Okay, what happened then? Stage 2, you did something. Ask questions, examination, assessment, this kind of happened, and blah, 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 blah. Okay. Then what happened afterwards? As she was quite worried and has a family history of Alzheimer's, you had a discussion about blah, 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 blah. Okay, and then you could put that. In view of the above, I have referred Mrs Welshman to you for full assessment and diagnosis, and okay. All right, so we could do it in that way, I think, and I think that would make a bit more sense, a bit more logic if we were to do it in that way. Okay, so again, we need that purpose to be clear. I'm writing to request, update you, inform you, whatever that verb is, all right? Blah, 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 about this person, okay? Then think, what's the story? So you could put, please note, you could put kind of here. I don't really need like this. If you put that she's a widow in the purpose part, in the introduction, then you don't need this. You don't need that here, do you? And what does that have to do with, with 5 kids? Her domestic arrangements are not my concern. If I were a GP, maybe arranging a home care visit, that might be my concern, but currently it isn't. So I don't need it. So get that purpose, I'm writing to request, thanks for seeing, who requires, blah, 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 blah. Okay, please note, Mrs Welshman has a family history of Alzheimer's, and mention something about the problem non-compliance. If you are going to connect it, join the dots, as in there might be some memory issues that began a few months ago. So, so you could do it in that way. Again, you're telling the story. So, please note, family history significant for Alzheimer's. Mrs Welshman came to see me 6 months previously regarding non-adherence to a medical regimen, possibly caused by forgetfulness. So you could maybe put something there, right? Okay, and then today's visit, she came, she said, what did I find? What did we do? What action did we take? Restate purpose. Okay, so that's how probably I would go about this particular letter. Okay, good. I hope that helps.